has the character of the COVID itself changed from the time it first emerged to now? Has it become milder? Or it's a chronic condition, or is it getting deadlier? Has it mutated? Will it mutate? Has it lost its virulence? Generally, I'm putting a lot of them in one bucket because a lot of questions around that. So, your thoughts?
Those are great questions, Sheej, and thanks for sharing. We really don't know yet. We know that the New York City strain, the strain that hit New York City back in spring, came from Europe, and it had certain novelties to it compared to what was going on in Wuhan in early January, February. Things that make the New York City strain a little bit different is that the amount of renal failure we saw in New York City was much more, 10 times more than what we saw in Wuhan. And that caught us off guard, but we attribute some of those differences to the viral mutation. Just historically speaking, just like the flu and other coronaviruses, we expect this virus to mutate. To be honest, this is a very smart virus. It is not that lethal that it completely kills its host and reduces its transmissibility. But it is very infectious, and it already has shown some mutations at a genetic level. So we do expect some mutations to happen, just like any other respiratory virus as the time goes by. Some of these mutations will reduce the danger. Some of these mutations will definitely increase the danger of this virus.
It's still scary, the way I understand it. And I don't think people are taking it as seriously as you say.
No, I'm in tune with some of the US data, and as we know here, there's been more than 100,000 cases in the US for the last 3 days. And when I talk to my colleagues in places which are getting hit hard, the Midwest, Minnesota, Chicago, they're essentially out of ICU beds now. And 100,000 cases today will essentially mean you'll need 10,000 ICU beds 10 days from now. And many of these states will be completely crushed and are completely getting crushed right now, having to deal with rationing care, which is a disaster scenario. I mean, we have now, even in parts of Texas, 10 patients coming in with 1 ventilator, and people have to choose who to give the ventilator to. So badness.